Well, hi everyone. Thank you so much for coming to this session. Um, I'm so excited to hear our talk today. Um, Dr. Ali Mirzazadeh is MD, PhD, MPH, he's got it all. He's an associate professor of epidemiology at UCSF. He's an Iranian American scientist, a physician, infectious disease epidemiologist at UCSF Institute for Global Health Sciences, or IGHS. Dr. Mirzazadeh is the Associate Director of the PhD program in Global Health Sciences at IGHS and co-directs the CDC-funded Health Equity Science Program. I also know Ali because of our work in the Women, Life, Freedom at UCSF group that we created October 2022. And we've done a lot of really interesting work and have been working hard with the Scholars at Risk program at UCSF to try to involve as many Iranian scholars with the UCSF work and fundraising for them. So I'm so excited to have him today, and he's going to be talking about new methods for population size estimation. So please take it away, Ali.
Thank you, Paria, for the nice introduction. It's so glad to be here and then see really friends and colleagues joining this session. So today I'm going to go overview of some new methods on size estimation, population size estimation, some adjustments to mapping data, and also I'm going to talk about extrapolation. So it will be fun to go through this because I'm going to bring many countries examples as we go through the methods. So it's a small group. Use the mic or use the chat for questions, please. And thanks for CAPS and Town Hall, and then Rochelle and the team to having me for this session. I will go through some more fun about me. Priya said about all the borings about my bio, but I will present a few more stuff here about myself and family, overview of the new methods I talked about, and then mapping size estimation, some adjustment to mapping data, extrapolation, and then I summarize. This is me. I born in Iran, 1978. So if you want to see where is my hometown, it's Kerman. It's south part of Iran. And I came to UCSF 2012, visiting scholar, postdoc, then research specialist, and faculty. And then I work with many amazing groups at UCSF. My research area is HIV, sampling hard-to-reach population, program evaluation for HIV mostly, but other infections. And I back to SF to LA for the 5th time next week. So join me, track me, and it would be really fun. This is me and Layli going love hiking as well in the Bay Area. So we are a family of 4, including a dog. Let's start with going to Afghanistan. This is a work we did in 2019, size estimation for the country with a population of 40 million. And then 57% of them are 15 and above, very young distribution population in the country. We were asked by the UNDP Global Fund to do this study in 8 cities in Afghanistan, looking at 3 key population, people who inject drugs, female sex workers, and MSM. And you can see the distribution is beyond, is more than 8 cities in Afghanistan. The size estimation previous work was done in 2012, and it was done only in 4 cities, those green dots. And then we added the, expanded to 8 cities. Some of those country provinces, cities located at the neighborhood of Iran, Pakistan, and also Tajikistan, as you see, including Kabul, the capital city. How we did this, we first defined the population of injection drug users to be a person who inject drugs or has injected drugs for non-medical purposes in the last 12 months. MSM was anyone who had anal sex with another one in the past 12 months. CX workers were any women who selling sex, vaginal or anal, and or sold sex in the last 3 months with money exchange, good exchange, or service exchange. So we also interviewed anyone who was 18 years and above, living in those cities that I looked at the map, and then provided verbal consent. The methods we used was many methods. So we used 6 methods for size estimation. As you know, there is no really one gold standard to do size estimation. So the hope here is to get a range of size estimation, and you use all those methods and estimation into account when you do the size estimation. So key informant interview, including finding those people who are working with these populations or providing services or have been part of those populations. So we interview with them to find the locations and the size associated with those locations. Then we go with a team to go to the hotspots, those venues, and then enumerate people in the hotspots. We interview with them to get the subtype as well. We also use a reverse tracking method, which I'll explain in the slides, how we can really estimate the size of hotspots using 2 sources of data. We also ask people in the hotspots to tell us how many other people they know locating in the zones, in the neighborhoods that they're living in. Give us a range, like on average, how many others, for example, sex workers they know in this zone or neighborhood in the city, and what is the minimum, maximum numbers according to their idea. We also distributed unique objects. We distributed socks to MSM, distributed hats to PWIT, and distributed hair colors to sex workers before the survey. And then we ask in the survey also how many people received those unique objects. We also looked at the counts in the service counts, HIV testing, HIV testing, needle exchange programs counts, condom distribution counts. And then we use a service multiplier for doing size estimation. We also had 3 rounds capture recapture, unique object to visit 1 at the hotspots, visit 2 at the hotspots to do the capture recapture 3 rounds. We collect all this data, we pull them together with the Bayesian approach called anchor multiplier, Paul and Willie developed these methods. And then we use that estimation. We also present data to a census, consensus, Delphi methods, workshop in Kabul. And then we use those extrapolation to the whole cities in Afghanistan, and the whole provinces in Afghanistan come to the national. I will give you some examples as I go through the slides. This is the number of the key informants, and we interview in the in-depth interview focus group discussions. For example, in Kabul, we had interview with 30 people, key informants, to get the locations of PWIT. 20 people interviewed for the female sex workers, and 20 key informants interviewed for MSM. In Kabul, a total of 70 key informants were interviewed in groups or individually to find the hotspots, and then how many numbers of the key population are belong to that hotspot. This is a picture from a focus group discussion. They're looking at collecting the list of the venues and also numbers associated with those. So overall, we interview with more than 400 key informants across the 8 cities to get the locations and the size associated with them. Then using those hotspots mapped, we send our team, 2 members in 1 group, gender matched. They visited the hotspots, and then they interview people in the hotspots. They count them. They interview with them with a short interview questionnaire to see what are their behaviors, main behaviors, and also what are they subtype. And we also had our team, M&A team, to visit the hotspots. So for example, those pictures are from Zaranj, which is the capital city of Nimruz province. It's a border of Iran, and it's a border of Iran and Afghanistan. This hotspot was so many injection drug users in one hotspot, as you can see, and then they go around and then count and then talk with them and interview with them. Our team visited over 700 hotspots across the 8 cities to enumerate the number of key populations in those hotspots. The source of the data for 3-round capture, including the unique object distributions. I talk about those unique objects distributed to PWIT, female sex workers, and MSM. A total of about 1,018 unique object distributed by the NGOs to the people in their neighborhoods and then coverage areas. Then we visited the hotspots using the mapping data. We count them again, how many people for each group represent in the first survey hotspot mapping. And then we visited more than 50% of the hotspots again to count the people at the hotspots. And then having the overlap between round 1, round 2, round 3, we were able to do a capture-recapture size estimation and use that for publisher size estimation. This is an example of the data results for male PWIT who inject drugs in Kabul, just an example of the whole study using several size estimation methods. So in Kabul, the prior data, which was collected size estimation in 2012, was 1.11% of adult population are injecting drug use. It goes from lower 0.59% to 2.42%. It's corresponding to more than 12,000 injection drug users in a city in Kabul at that time, which was about like 5 million population. We use reverse tracking. It's ended up to having like percentage 0.65%. Unique object multiplier was 0.46%. Capture recapture, it was 0.21%. And then service multiplier using the free needle was 0.21% with lower and upper bound. The wisdom of crowd was 0.41% in the range. And then all of those numbers was our estimation, excluding the prior, because the prior was the study done in 2012 with the service multiplier. Those are our estimations. So then I think my question for you is like, how would you drive into a one single, maybe best estimation using all those numbers? So one idea would be just make an average. Not a good idea because those numbers are small, not normally distributed. If one of them is extreme on the lower end or upper end, that will really pull the average towards the end, towards that end. Maybe take a median. This was a usual approach. Still, most people use it. So it's assuming like the value of each of those size estimation is the same. It's assuming that the biases is the same. And then when you average them, you're not averaging them. Median is like the midpoint in between. It's really it's working. It's a method that's easy to use, simple. But the assumption here is like the value or the precision of those single estimation are the same. The other method is like, why not if present all these methods to the experts in the country, those who know the epidemic, knows the local knowledge and setting, and let them choose one or come up to a formula to get an average or something like that to find one estimation. It's good because it's buying their thoughts. It's engaging. Those stakeholders most likely is going to accept and use those numbers, but it will be vulnerable to the people who are in the room. And depending on the time of the day, what is their mood, they may come up with higher or lower estimations. So it's really biases to who are in the meeting and what is their thoughts about this. So is there any intention to increase or decrease the size estimation? That's also, it's unknown. But then I talked about this method that was built by Paul Wessam and Willie and me. It's a Bayesian approach. So basically we are talking about, let's say you have some knowledge about the size estimation of male who inject drugs in Kabul. This is coming from 2012, but then you collect new data, which is the likelihood. Those new data coming from capture, recapture, multiplier, unique object, and mapping, and so on. And then you are going to combine them by using the Bayesian approach. Basically, you're using a prior distribution for your information and using the distribution for all data you collected in your size estimation project. And then you combine them and then produce a posterior distribution for your size estimation. And then from the posterior distribution, you can take an average, you can take a median, or you can also present the uncertainty interval. And that's really good because you are using all available data to come up, to update your numbers to a distribution that you can describe later on with an average or something, credible intervals. Let's look at this size estimation for male who inject drugs in Kabul. So that was all the data from 2012, and then the new data comes in 2019. If we pull them with this Anchor multiplier Bayesian approach, with the variance adjusted, your size estimation would be 0.47%, with the credible interval of 0.33% to 0.64%. That is corresponding to over 5,000 injection drug users in Kabul in 2019. How you can use this approach? So basically, you need in compared to the median Delphi, this is better approach because it's reproducible. So whenever you're going to describe your prior data and then your data is up there, and you can also have any of those estimations that goes to the calculator and goes with the precision. So if they are very unprecise data with a wide complexity interval, their contribution to the post-distribution would be less and less. And that is good because it's part of the systematic approach to really combine the data. The Encore multiplier cannot fix biases in individual size estimations results. They has to go with the quality of those data, but whatever it goes to the system, it produces a posterior distribution. This online calculator is available on this link in the Global Health Science website. There's an instruction you can use, so I put those links if you want to explore data. But let me show you how this works. So it's going to ask you what is the general population of, here we're talking about male adult population in Kabul. So that is 1.1 million male adults living in Kabul at that time. The prior data is from 2012, 1.11% to, and the lower and upper percent. And your data is reverse tracking methods. You're going to say this is a percentage. That's a mean of the distribution and also lower and upper limit. You're going to add one by one your size estimation, unique object multiplier, capture, recapture, and so on. And then you're going to push the submit button. This is what you get. It's a forest plot. It shows you the prior data was 1.1%, 11%, but it was very wide. And then your data, new data in terms of the foil was a bit narrower, but also at the lower end. And it's produced two estimation. One is Encore multiplier. The other one is Encore multiplier variance adjusted. What does it mean, variance adjusted? Basically, it means like you're using a random effect model to combine those data. So if you're familiar with the meta-analysis systematic review, you can assume each estimation is coming from a different source of population, different methods. So they are very different from each other. So accounting for those random effects, then this is a random effect pool estimation. This is a fixed effect pool estimation. We use a simulation, and also in several data countries, we found that if you use the variance adjusted, most of the time it's better because it's going to be more, it's going to be less precise, but also it's more likely to present the truth in the population. So basically, we present the Encore multiplier variance adjusted as a random effect model for pooling all the data into this Bayesian approach. And this is a table you can also export from the website. So it can give you the exact numbers, which wasn't easy to read from the forest plot. These are the numbers, and then these are the counts, and then this is the distribution. So if you want to redistribute the posterior distribution, you can use alpha beta to come up with that distribution, exactly what you want to produce. Let's go to the mapping, and you know, I'm not following the chat, but if there's any questions so far,
yeah, Alijan, do you want questions as they come, or do you want to wait till the end?
Yeah, well, no, we can talk about them. So please.
Edwin had a question in the chat. Edwin, do you want to just ask your question verbally?
Oh, just, yeah, you said, you know, what approaches would you use? You know, one of the things I always try and look at is when I'm seeing some impact of outliers and biases, it's like, oh, well, let me just try and do some bootstrapping across all of these and see how all these different methods perform, et cetera. So that was one. And then another question, like, how sensitive is this method to your prior? I mean, have you done simulations like if the priors are really bad, you know, garbage in, garbage out, or how well does it perform, and how dependent on the prior, just, you know, the quality of the priors are they?
Yeah, great question. So when you talk about the Bayesian approach, everything symbol, the first question, like, how is your prior? How is your, are you sure about the prior? So as you see in this example, the prior was from 2012, and it was very wide. Yes, so that means its contribution to the final product distribution is less than the new data. So that's good. It's based on the data that was validated, was a method, it was published, used for many, many years. So it's based on the data. It's based on nothing. So you should not close your eyes and say, I don't have nothing to know about the p-word, but this is the new data for p-word size estimation. So basically using the prior, I think it's valuable. It helps you, and also it's produced credibility for your results, because you're not ignoring the fact that it was 1.11% in 2012. The other question is how sensitive this data is to prior. You can change your prior to be more precise, or decrease the precision around it. You can also drop some of the estimation that you think are outliers. So for example, if you think mapping is only captured to people who goes to the venues, and it's like 0.01%, it's really small number. It means like you only captured like a very small portion of the size estimation in injection drug users. You can drop those and then redo this calculation. We call it jackknife approach for sensitivity analysis. We usually decide to drop or not drop those things in a workshop. So we run this, we let them choose. But when you use the prior and other data, dropping one size estimation is not going to change the posterior distribution that much. And that is good, because you want your results to be not really sensitive to one alpha.
Yeah.
So that helps. Bayesian approach helps with the extreme effects of the values on your posterior distribution.
Great. Thank you.
Yeah. And that's why we are saying variance adjust is better, because it's give you a little bit more variance here. So that's good. So you don't want to be very precise, because it's a size estimation, and we are not sure about any of those methods. I hope I answered your question. Is there anything else, or should I move on to the mapping?
Just to tell you, Ali, that I'm dropping the links into the chat for anybody who wants to be able to, follow along.
Okay, thank you. Let me keep going. So let's talk about mapping. Mapping and enumeration, it's a very useful approach, because it gives you where are the hotspots, how many people are in those hotspots, and then it's a really good value information for people, or for programs who wants to reach to those populations. So it comes with where to find those populations. It's valuable, but it's a little bit sensitive to like what time you go and count people, where and when you find those hotspots. There might be a seasonality effect. Some people don't go to the hotspots. Some people are mobile, they go to multiple hotspots. So all of those things may affect your results. So could you do something to adjust for those effects, and then produce adjusted mapping size estimation? This is what I'm going to talk in the next slides. So we looked at the data in Afghanistan, and we found that for one hotspot, for each hotspot, if you look at the key informant data, there is one size estimation. If you look at the wisdom of the crowd, people in the hotspot, what they think about the size of the hotspot and so on, there is a different idea here. If you look at enumeration in the first round, second round, for the same hotspot, you will see a range. So what are you going to do? How about to count those variation when you're presenting the data on hotspots? This is not the usual approach, but this is what we propose for Afghanistan, and we publish a method on that one. So basically, we are going to use all those variation to estimate the size of each of the hotspots for the size estimation and mapping exercise. This is an example of, like, imagine like the key informants tell you that there are 8 spots in a city for injection drug use. And for each hotspot, they told you this is the size of the hotspot for people who inject drugs. But then you go to the hotspots, you visited 4 of them. So basically, you have data for 4 hotspots, observed data, but you have data from key informant for all the 8 hotspots. What you can do, you can use this reverse tracking approach. So what is the ratio between those hotspots that has a key informant and you observe? That is a ratio that you can apply to get these numbers to get 135 to 131.7. You can also look at this ratio. Look at this ratio and also the numbers, and also you can estimate, you can produce a variance for each size of the hotspots. And if you add up all the variances, it would be the variances for the total size estimation. So the adjusted, the adjusted ratio size estimation is 132 here, and then the variance is here. So you can produce a confidence interval for that one. So the confidence interval would be something like 113 to 151. And then you can apply this ratio and to each of those numbers reported by key informant interview. These numbers here are ratio, using the ratio between the observed and the key informants, but also you're estimating the total size estimation for the whole 8 spots. But also you have a variance, the confidence interval for each of the hotspots. So these methods, reverse tracking methods, with all those formulas, can help you to present the data for mapping using some variation that comes up with each of those hotspots and the total size estimation. So we use this approach. We also were asked to looking at the effect of the winter time. The hotspots mapping and enumeration was done in the winter time. Was there any seasonality pattern to those numbers? So we looked at the data from the program. So these are 2 cities in Afghanistan. They were able to provide us the number of people who inject drugs who are receiving the services over 12 months for each month. This is Kunduz, this is Faizabad, and these are the 3 months we have done the mapping. The rest of the months, we didn't have mapping, so we don't have any idea if it goes up and down. But we can use those data, count data in the program to see what is the ratio between the number of people in the program in the 3 months that we observed in compared to the rest of the year. So we use that ratio. It come up to Faizabad is like 130% ratio for a number of people averaging months services in those who in months that we didn't observe to the months that we observed. The other one, Kunduz, was 10% more, and then we use the total, like 10%. So it tells us this data that if we should increase our numbers by 10% because in those winter times, less people go to the programs, and we are assuming less people also go to the hotspots to those locations. So we adjust those things. We also were asked to really do size estimation for females who inject drugs, but we went to the venues. We only found 9 female injection drug users in the survey. So what kind of data we can use to estimate the size of female injecting drug users in Afghanistan? That was a really big ask from Global Fund and all the national partners to do that. So we look at the data. We found we can have number of female who inject drugs by the key informant interviews, but also wisdom of the crowd. So we use those numbers to come up with the number of female who inject drugs. So basically, this is the idea. So we had key informant interviews, focus group discussions, how many male, females goes to the venues. You can see them in the city, in each city. We also have wisdom of crowds, people in the hotspots. We asked them about how many women, how many male injection drug users are in these neighborhoods. So you can see the ratio here. So basically, we found if we average the 2 methods, 96% of the all injection drug users are male, and then 40% of the all injection drug users, according to this data, are female. So we use that ratio to come up to the estimation for females who inject drugs. So applying all the correction factors, we use the hotspot time variation by reverse tracking methods. We use invisible females by increasing as a 4% for estimation of the total p-width for females. And then we also increased by 10% for seasonality. This is the results. So the number of the hotspots for the 3 key populations, we found more than 374 hotspots for p-width across the 8 cities, 286 hotspots for MSM in 6 cities, and then 237 hotspots for female sex workers across the 4 cities in Afghanistan. We used the male to total ratio to get to the number of females injecting drug users, and you can see the results here. So there's a total of 25,700 injection drug users in 31 urban cities in Afghanistan, with a lower and upper estimation. The prevalence was 0.7%, 0.52 to 0.8% for the adult population in Afghanistan. We didn't use these methods, but I wanted to present this so that you can do this adjustment when you're doing the mapping. So when you go to the hotspots, you can ask for people in the hotspots if do you visit other hotspots, and how many other hotspots do you visit? So if you collect that data, what proportion of people in the hotspot visit another location at the peak day, and then how many on average hotspots they visit at that time. So if you have P and M, you can adjust your size estimation for double counting. So here an example. So hotspot 1, the size estimation was 20. 10% of the people in the hotspot visited on average 2 other hotspots. If you adjust for that one, your adjusted size estimation would be 19. If 50% of those people visited on average 2 other hotspots at the peak day, your size estimation would goes down to 15 from the 20. So you adjust for those things. If you adjust for the 3 hotspots here, instead of 60, you're going to report about 47 people in those hotspots, which is a good thing because you don't want to double count people who goes to the different hotspots for finding clients or fun or hanging out with their community and peers. The questions that you can ask, I should give credit to Ivana about this question and credit. So basically, you can ask this question during the peak day of week. Do you find clients, for example, more than one venue? And then on average, how many venues do you visit at the peak day? So if you do that, collect those data from the people in the hotspot venues, you can adjust for double counting. I want to stop here for any question, but I think the next slides section would be talking about extrapolation of size estimations. Paria, do we have any questions?
There's no questions right now in the chat, so if you want to continue, and then we can.
Okay.
This is great. Thanks
so
for.
fast,
No, it's great. It's great. I think.
Okay.
Yeah.
So most of the time when we collect any data in a sample or in a study, we don't have a chance to look at all the locations, look at all cities, for example, to do the size estimation. We usually come up with size estimation in 6, 3, or 10 something locations areas. And then the question here, how many total injection drug users are in the country, in all provinces, in each of those districts provinces? So that is a question is always asked. And it's a hard one because how you can get a sample and then go from sample to the total. We call it extrapolation. It's a statistical technique. It's aiming at knowing what is unknown from what you know, basically. For size estimation, that means you collecting some data from observed data, and then you're going from observed data to unobserved, district level, province level, and then national level. It can be done by using statistical methods. It can be done by consensus, Delphi. You sit in a workshop or Zoom in, and then people talk about, oh, this is 1%. Okay, here in Kabul, then it's 1% here in this Nimruz, and then so on. It could be a combination of those. Sometimes in the epidemiology, they call it transferability of the data. There are some techniques, and then there's a new methods about that one. But those methods not very often used in the size estimation. That's why I want to talk about extrapolation. An example of an extrapolation is this study, a really cool study in Vietnam. You should look at this paper if you're interested, about a social app use and then multiplier in provinces, in 11 provinces in Vietnam, and they use this data to go all the way to 55, I think, provinces in Vietnam. So they really did a really nice job using the stratification methods to go to the national level. But what are the methods that we have for extrapolation? The methods for extrapolation can go from simple one to a little bit complex and then go to the sophisticated one. What am I talking about? The simple way of extrapolation means you collect your data and then your size estimation across the cities you observe. You make an average. You provide a prevalence of, for example, injection drug use in those study sites, and then you apply this observed one size estimation proportion to the unobserved locations, and then you add them all together. And then for the whole country, it will be the same proportion. So it's a simple way, but there's a big assumption. Does this make sense to apply one average proportion of sex workers to the whole country and unobserved areas? The stratification means you think about some grouping. So you collect size estimation in big, middle, small cities or rural areas, and then you have some idea about those locations and grouping, and then you have one size estimation for each of those areas we call stratum, and then you apply this proportion to the other areas in that stratum, and then you add them together, and then you go to the one level up, and you go one level up to the national. The model-based means imputation, linear, Poisson, or other regression models use a proxy data predictors to estimate the population size for unobserved locations. So I will talk about that, but basically it means assume those areas that you don't measure size emission, they are missing, and you're going to find a model to impute those missing. So this is the idea. You can use different models, and then I can present one example that will use Poisson to get that numbers for Afghanistan. Let's go one by one. This is a simple way of doing size estimation, extrapolation. We go to Iran, and this is my country. We did size estimation in 2017, 2016 of the female sex workers in major cities in Iran. 13 cities, as you can see in the map, were the site of size estimation. We used multiplier methods, wisdom of the crowd, and then network scale up to do the size estimation. For each city, we choose the median. At that time, we didn't have this encore multiplier. So we use the median for size estimation, and then make the average of all those three cities size estimation. We come up to a proportion of 1.43% of the adult female in Iran are female sex workers. And then we apply this to the all capital cities, 31 capital cities in Iran, and also apply it to the adult population in urban settings in Iran. We came up to about 230,000 female sex workers in Iran at that time. Why this simple way works? Because we had enough sample across the Iran to make an average. So it was everything, it was enough at that time to assume this is a good representation of the whole country. And a simple way of pooling us data and using one proportion to apply it for the all cities, not all city, non-cities areas, but cities areas, urban areas in Iran makes sense because of the design of the study, because we are able to do this study across the country. So that is the simple way of doing the extrapolation. And the paper and everything published in +1. This is an example of stratification. So this is a study we did recently in Papua New Guinea. This is a country of 10 million, and 65% are living in 12 years and above. The methods that were used, so we used the prior data from 2016, 2017 as a prior knowledge. A new size estimation data comes from mapping, capture, recapture, and program counts, which is interesting. So we talked to the people in the country and program. They said, we have good, unduplicated, clean data on people who are receiving the services across the country for female sex workers, MSM, transgender women, and so on. So why you don't use those as a data point? Say, okay, we can use them. If you think the data is good quality, we can use them. The new size estimation only include 3 areas. Port Moresby is the capital city for the country. It's an urban area. Lae is a port city again. It's a semi-urban area, and you can see on the map. And then Mount Hagen is a rural city. Even if it's it's a city, is a capital of this province, but everything about DHS data, expert opinion say this is a rural area. So we had one for each subgroups size estimation. We use the data synthesis for adjusting, for using the prior data and stratification to pull in numbers, and then we extrapolate those to the 3 locations, 3 subgroups for 22 provinces in Papua New Guinea. This is the results for example, for female sex workers, multiple size estimation for each city. This is the capital city. This is Montagan. This is Lae. This is the prior data mapping capture program counts. They all pooled by the Bayesian approach to 8.4%, 5%, and 8% of female sex workers in the country. This is I've never seen this high numbers of sex workers in any setting in the country. So this is very unique setting. So those numbers are, this is for urban areas, this is for semi-urban, this is for semi-urban, this is for rural areas. So then we use those proportions, we apply this to the other areas in those stratum, and then we add them together, we come up to close to 200,000 sex workers in the country with this lower and upper size estimation. And the national size estimation for sex workers was 6.2%, goes lower as 4.3% to 8.5% for the country. We present this data to the national stakeholders, many expert opinions, looking at the DHS data, triangulate the data. I know this is really high for female sex worker proportion in any country, but this is supported by the data. Let's go back to Afghanistan. I'm going to use Afghanistan to present this model-based extrapolation. So as you remember, we use 6 methods for size estimation. We synthesize the data for each city. We make that Encore multiplier for each city. And I'm going here to present male people who inject drugs as an example. For the extrapolation, we use a Possum model, and then we use proxy indicators. So we use proxy indicators to make a model, and then we apply that model to go from the observed locations to the unobserved locations. I'll give you the results, but then I will go to the methods. So the number of male who inject drugs in 8 cities was estimated to be about 11,000, corresponding to 0.7%. Extrapolating by proxy indicators, the total number of male inject drugs in Afghanistan was estimated to be about 55,000, can go as lower as 40% to up as 71%. This is the table I wanted to show how we come up with the proxy indicators. So we put this table, those lines that are green are observed locations. So for example, Faizabad is a location that is a total population of 74,000, the urban population, adult population, literacy proportion, population density, person living in under poverty, population unemployed. At least one major road exists in 10 kilometers from the city border, drug trafficking routes, and all of those proxy indicators were there on each of those lines for the observed and unobserved capital cities for Afghanistan. So we use those green lines to make a model. How we choose the best proxy indicators, how we come up with the Possum model. So we use lasso regression and also data overlapping. We selected the percentage of population unemployed in 2017 as a one proxy indicator to make that model. So those are the models. So if you want to predict size estimation for any location in cities in Afghanistan, you need to apply this exponential of something, a formula, and then times it to the adult male population. The only thing that you need is what proportion are unemployed. We use this formula 1 time for point estimation, 1 time for lower limit, and 1 time for upper limit to estimate the point and lower and upper size estimation. But how we choose the unemployment, basically we use the lasso regression first. So the lasso regression is the algorithm will tell you what is the best fit for your model. If you have this 10, for example, 15 proxy, use all of those and tell me which proxy I should use in the model. The lasso did the job and it say you should use proportional unemployed, border with the city that produce drugs, and then HIV reported cases. But when we look at the data between the observed and unobserved sites, we only see that the proportion of unemployed has a similar distribution between the observed and unobserved sites. So then we choose we said, okay, lasso, we can only accept the proportion unemployed. And that was a good idea because that was a good fit to the model. So based on the data overlapping and the lasso algorithm, we choose one proxy to make that Poisson regression. So therefore, we excluded the other two from the model building. This is the step. So we use the data from 8 cities here. So we developed the model by using Poisson and using one proxy, which is unemployed. We apply that method, that formula, to the unobserved cities in Afghanistan. We estimated the number of people who inject drugs and so on. And then we add them all together to produce the final size estimation for all 31 urban sites. And then Global say, I want all the numbers for the country. So we applied the same proportion to the adult populations of the whole country. That was Global Fund. So it's really hard. When they want something, they want something. So you can't say no. I want to quickly go over the quality checklist, extrapolation, the methods of extrapolation and assumptions should be there in the methods. If you're using proxy data, present and give that tables of proxy for all cities, observed. And then the reason if you're excluding proxy from your model, collinearity, lack of overlapping, to be clear about that one, do the extrapolation by point estimation and upper lower limit because there is always uncertainty about those estimation. And also when you present the results, present them back to the stakeholders and then ask them to questions, really talk to them, really find a way to really verify those numbers and then have them buy in the numbers because if they don't buy the numbers, it's going to be less likely to use them for any programming. I want to summarize here. So there's a lot of methods for size estimation. None of them is perfect. Mapping has been used a lot of times. The variation is hotspots is not presented for most studies. So you can use these methods to really account for those adjustments, but also variations in the hotspots. Extrapolation is also several methods. If you are not sure about one extrapolation, do a sensitivity analysis. Always be clear about what is your assumption, what is your inputs, what is your output. So always present that one. And I want to stop here with saying that we have this program that will teach all those methods in a hard to reach population. So if you're interested to apply, if any questions, scan that barcode. You're welcome to apply. You still have 2 days to apply for this course. And it's completely free, and then we provide stipend as well. And I want to finish here before going to the questions. We had pleasure to work with Miriam, who was a Canadian. She was an aide worker in Afghanistan, and I know him from the few months we started working in Afghanistan. She was there for 20 years, and she was very passionate to work with Afghanistan and people. She actually passed away in a car accident a few months after we started the project. So I always remember her, and I really want to really dedicate this work to her and then her passion and her work for many years in Afghanistan. And I want to thank you, the funders, for the study. So I stop here for question. I will stop sharing as well.
Thank you so much, Alijan. That was really great. Nia, do you want to ask your question just verbally?
Sure. Hi, Ali. It's nice to see you.
Good to hear from you.
I know we have to meet in person when I'm on campus, but I was wondering, can you speak a little bit more? So your sort of lasso prediction model identified these 3 predictors, and you said through sort of a comparison of observed data, is that correct? You decided to keep only one of the predictors. Could you speak a little bit more to that approach? I guess I'm curious if there are other factors that could explain why there wasn't as much data overlap with the other 2 predictors, and like, would you be concerned that your model maybe, your sort of final Poisson model maybe like quote unquote overfitted based on the one predictor alone? Like, could things be missing essentially?
Yeah, absolutely. You are so advanced now. I try to catch up. So basically the overlap problem is when you have observed data and unobserved, okay, you have 2 groups. And the distribution of the proxy data should be about the same in the observed versus unobserved. What is the problem when you make a model? Anytime you make a model, if you only have data, for example, for a regression, that you only collect BMI as a proxy between 21 and 35, you can't really predict what is the like a risk of like heart disease if someone with a BMI of 45 show up at the clinic. So basically that's the idea. You shouldn't use that model because in the model itself, you didn't observe anyone in the BMI of 45. So this would be out of range. The overlapping problem is happen when you make some models based on a range of size estimation or proxy unemployment that is between like 20% to 40%, but then you have some data that is not overlapping something. So that's like you shouldn't use extrapolation or model when you don't observe that area of relationship. The lasso is an algorithm, so you didn't look at the overlapping. You should look at the distribution by yourself and then choose that idea. So that's why lasso and data overlapping is two things to choose the best proxy. Yeah. Question, Farid.
Thank you so much for the great presentation and as well as data about Afghanistan. I was not involved like in huge data, but I know like how the data collection is complex in Afghanistan. Specifically, we don't have like a lot of protocols data there, like, but I learned a lot of things from this presentation, and this could really help like to document while in the future, like any organization who are conducting like such kind of research, this will be very useful. And I learned a lot about injecting the users, and this data was useful for me. So I wanted to thank for you and your team. Thank you so much.
Thank you. So glad to having you here. Thank you so much. Farid is a colleague working in Afghanistan for a long time and now in ITABS. So Farid is looking at maternal health and deliveries data. So I think one time you should present your data as well.
Sure. So once it is published, so I will be able to present it. Thank you so much.
Awesome, Farid. Good having you.
I'm going to make a mental note of Farid's name so I can reach out to him. Any other questions? I had a quick question. I think this is so basic, but I was so, really impressed by the number of key informants you also had in Afghanistan, and I was just wondering how you identify the key informants and how you get them to speak to you, just because of all this the stigma and the you know the taboo nature of the topics.
Really good question. We had a fantastic local NGOs working with multiple cities. They were also providers for many services for key populations. They make this happen. They talk about this project. There was a national support team. All the local districts, health authorities, they also were involved. We reach out to many people. We reach out to many administration, national program, HIV support desk, Global Fund, UNDP was involved, WHO. So when you go with this kind of work, you really have a formative assessments, preliminary phase to build in that report with the local NGOs, community, invite them to the workshops, invite them to the projects. You can't believe when I was in workshop in first time in Afghanistan, it was a basement, like 3 rooms, something basement full of people who working with the NGOs, men and women. And they were there. They were really there to learn the study, help with the study, very engaged participants. So I think having a local partner, having really, and also talking with their language. I was talking Farsi, and they really like that connection and language and culture issues. So I think it helps a lot with this project. So I think those are things you would learn, but working with the local community, local partners is a key.
Thank you. Just want to invite other folks to ask questions. if not, I'll ask another question. Well, two questions. One is I'm just wondering, what new projects that you have related to the size estimation that you may want to let us know about. What's coming down the pike.
You're interested to know how many injection exist right now in other countries? Well, I think the next one would be Vietnam, looking at their size estimation for MSM. They collected this data from multiple sites. They're collecting data for also injection drug users. That is something Willie and I working with. They approached this community from a RDS-based responder sampling using on top of the HIV sentinel surveillance, which is a new approach. They're looking at this data. That is next. I'm sure Willie has tons of countries to work with. So those countries will come up. This number of female sex workers in Papua New Guinea is the one. I don't know how we can publish that one, but trust me, we talk about this 8% adult population sex workers in the country across multiple sites, across DHS, with number of clients. I think it's supported by the data, but it's a huge number. So that is exciting. At the same time, I mean, what their program was going to do, I think this is something that they should really acknowledge and then really find them and then service them. Those are the things. Most of the time, every country, they update their numbers every 2-3 years. That's also happening. So, we're collecting data, designing data for Pakistan. It's a huge study, more than 100,000 sample size for the IPBS, 8 key populations. So that is happening. So next year, maybe we talk about Pakistan.
Inshallah. Well, thank you all so much. If there's no more questions, we can adjourn a few seconds early. And you have a comment in the chat about coming to do some of this research in Africa.
Cool. I'm looking at the chats.
And
Thank you
lots
all
of
also
thanks.
thank you for doing the poll. I'll leave the meeting open for another minute or so if you're still working on it.
Thanks,
Thank you, everyone.
everyone.